happy with recent changes in rules and regulations related to health insurance. Now, covering pre-existing diseases is mandatory after a waiting period of 3 years. Additionally, there's a significant relief for Aman. If the health insurance policy remains active for 5 years, then the insurance company cannot refuse to cover any treatment expenses whenever he falls sick. However, for all these types of conveniences, Aman will have to pay a price. After the announcement of the changes in rules and regulations by the Insurance Regulatory and Development Authority or IRDA, many insurance companies have announced an increase in premiums to cover the increasing number of claims. Now, policyholders like Aman will have to pay higher premiums at the time of policy renewal. In fact, when health insurers determine the premium for a product, the factor that how much claim can be made is predominant. The company estimates how many claims may need to be settled for the product. For the recent initiative of IRDA, it's certain that the scope of the policyholder's claim will increase, and this will increase the burden of claims on companies. To compensate for this, insurance companies are preparing to increase premiums. According to experts, health insurers are currently busy calculating the cost of doing business. Based on this, insurance premium may increase by up to 25%. The rise in premiums will affect all categories of customers, but a higher increase in premiums may be seen in floater health plans. Aman has taken a floater health plan with coverage of 10 lakh rupees for his family. Last time, he paid a premium of 32,000 rupees. Next time, whenever he renews the policy, he may have to pay up to 6,400 rupees more. People who have taken higher coverage will have to pay more premium in the same proportion. However, it is not yet certain how much health insurance premiums will increase. Insurance companies will send a proposal to increase premiums to IRDA according to their products. After IRDA's approval, the increase in premiums will be implemented. HDFC ERGO says that it has become necessary to increase insurance premiums. They attribute this to providing of good services to customers. Considering the cost of claims filed in recent years and the anticipated future expenses, the company needs to raise premiums. The company will have to increase health insurance premiums by an average of 7.5 to 12.5%. Customers have been informed via email about the premium hikes, which will be determined based on the age of the policyholder. It will also be determined on the basis of which zone that policy was purchased in. ACO General Insurance Company says that health insurance premiums could increase by 10 to 15% to cover the increasing cost of rising claims. Now, let's understand what changes the insurance regulator has made in the rules of health insurance. So far, insurers covered pre-existing diseases or PED after a waiting period of 4 years. IRDA has reduced the waiting period for this PED to a maximum of 3 years. Similarly, the moratorium period has been reduced from 8 years to 5 years. This means that if Aman maintains his policy continuously for 5 years, then after that, the insurance company cannot refuse to pay a claim for any disease. From this point of view, all types of waiting periods will be considered over. One change is related to senior citizens. So far, insurance companies only provided coverage to people up to the age of 65 years. Now, IRDA has clearly stated that insurers cannot refuse insurance to people over the age of 65. Midas Finserv's MD Rajesh Bansal says that recent changes in health insurance rules are likely to increase the burden of claims on insurance companies. Recently, IRDA has also made provisions for cashless treatment in any hospital across the country. Previously, insurance companies used to charge a co-payment of 10% for treatment in non-network hospitals. It also led to fall in their income. To compensate for this fall, insurers could hike health insurance premiums by 20 to 25%. In the current scenario, premium hike is necessary for insurers to maintain quality treatment facilities. Medical expenses in the country are rising rapidly. On having insurance policies, additional expenses are imposed on policyholder with high treatment costs in private hospitals. Now, this also contributes to the increasing burden of claims on the insurers. If the government sets limits on treatment costs, if the government imposes restrictions on unnecessary treatments and tests in hospitals, customers could get a slight relief from high premiums.
Now, you too can ask any question related to personal finance on the Money9 app. Do you have a query on stocks, mutual funds, or tax? Now, you can directly ask our experts. Connect with them anywhere, anytime. Ask your questions in Hindi, English, Marathi, Bangla, Gujarati, Telugu, and Kannada only on Money9.